Okay. What I guess would be great is what I'm going to do is give you an overall talk around EDPs, how we are involved in Devon Drug Service, and what we do here and what our ethos is. And if there are any questions, feel free, and I'll give you a quick tour of the building as well. Remembering that it's a working day, there are clients around, and there may be areas we can't go into because of things that are happening at the moment. Yeah. Okay. Whilst you're here, and as I'm being recorded, I'll best let you know, fire exits. Just straight out here, on the left there's a fire exit when you're in this part of the building, and there's one downstairs which I'll point out when you go down as well. And there's obviously the front door, and if there is a fire drill, which there shouldn't be, across the road where you came in, we got out of the taxi, that's where we mean. Okay, so anyone involved in the drug and alcohol field from you guys? No.
Yeah, I've worked in this sort of sector a bit because I used to work in the criminal justice sector. So.
Okay, my background as well is criminal justice sector, yeah. I worked in the criminal justice sector in East London for about 7 years. Okay, so EDP, now call ourselves Devon Drug Service really, although EDP is still an organisation on its own, but we work in partnership. Our contract is in partnership with the DPT, Devon Partnership Trust. And we used to work as two separate teams really, as EDP and NDAS, who do the prescribing. Now we work as one organisation, Devon Drug Service, and that's how we do it here. And there's different people around North Devon and South Devon. This is a symbol of North Devon Drug Service. Historically, drug services have come from two backgrounds really, from total abstinence and from harm reduction. What we do here, and EDP's really ethos behind it all is harm reduction. If I can say, if one of my colleagues here has a client come in to see them and they're injecting heroin into their groin or into their neck, or which a lot of our clients do, then it's a result for us if we can at least show them a safer way of injecting. Or if we can say to them, how many times are you injecting a day, and do some positive work around maybe reducing that a little bit. That is a result, it's harm reduction, because one, we're going to make it safe for them by showing them different ways of injecting. And ideally, that's the very beginning of treatment. It's a great way into treatment. At the end of the road, hopefully, we'll get someone total abstinence, who isn't using drugs at all. Or if maybe they're using something in a controlled way, then maybe that's a result as well. It's what that individual wants. The big thing for us is that it isn't just us saying to someone, this is your treatment plan, this is what we want at the end of it, and when you're drug free, that's a result. The service user and us, we work together, so we come out with the objective at the end is what they want and what we want. And we use lots of different skills around motivational interviewing and brief intervention therapies and many different methods, I guess, to get the client to where is the best place they can be at that time. So, I guess how do we do that? For those that aren't aware, the drug treatment process is broken down into tiers. Tier 1, 2, 3 and 4. Tier 1 would be if someone was to go to their GP and say, I've got a drug problem, I want some help, or to any specialist service, probation officers, or whatever, say I've got a drug problem, then that would be a Tier 1 intervention. They would signpost probably, if it's next to us, or wherever. The minute they come to us and ask for some help, then it becomes a tier 2 intervention, because we're a specialist drug agency. So it's actually a tier 2 intervention. And a tier 2 intervention could be anything from someone coming in and being offered advice and information. It could be a needle exchange. It could be a parent coming in asking for help and advice, and so on. When it becomes a tier 3 intervention is when a care plan is involved, and it's the care around that client is formatted. Maybe you do a care plan, then that becomes a tier 3 intervention. For instance, if someone was to come in with, say, a heroin problem, and we decide with the client that the best intervention is to call a methadone script or a Subutex script, then what we do is they'll have a brief intervention, then they'll have a full assessment, and at that full assessment it'll be clear that we need to get this client onto a script, and that's what they want. A care plan will be done at that stage, and that client will then become a tier 3 client. So what I have here is 3 drug workers who work in the tier 2 part of the service, which I will take you around and show you, which is very interesting, needle exchange, places like that. My 3 drug workers also run workshops at tier 2 and at tier 3 level. We have approximately at the moment 29 different workshops, and I'll talk to you about those in a second. I have 3 support workers and 3 care coordinators. Care coordinators oversee everyone's treatment, so for an average caseload for each care coordinator is about 75, which is very high, but actually they're just coordinating the treatments. They will do the initial intervention, but then they may not see them for 12 weeks because they'll put them out to a drug worker or to support workers who will look after them for a while. And they'll be reviewing, the care coordinator will be reviewing their treatment. And then I have volunteers as well, which is a great thing we've got here. I have 10 volunteers working in this building, which I think is amazing. The gift of time that it helps us to run a really effective service. We can run the service without the volunteers, but with the volunteers, obviously, it gives us that grace of time and the ability to do some add-on services, really, add-on stuff. We also have a mobile outreach. So our area is Exeter, East and Mid Devon. So which covers us basically from Exeter over to Dorset up to Tiverton. Quite a large area, and this is for this building really. So we have a mobile unit as well. The mobile unit goes out now 3 times a week. Where we go, areas at the moment are, for instance, Oakhampton, Axminster, Seaton, and where we're going now. We also actually go into Exeter, and there's another location I can't remember off the top of my head. And that will be my drug workers as well, who do that with volunteers.
So do you go out Crediton way as well, or?
Well, I guess we do go to Crediton. The reason I didn't mention Crediton is at the moment we're not getting a great response up there at the moment, so I'm just still playing with it in my head at the moment to see whether we stay there or whether we move on elsewhere. But at the moment, the police, for instance, we work very closely with for our mobile unit, because if someone was to see it, they would think there's dealing going on in the middle of car parks and that. So the police were aware of what we do and where we do it. And they're very supportive, especially in Crediton actually.
Yeah.
Extremely supportive. I meet with them regularly. However, the location maybe needs to be sorted out there. That's what that's for. So yeah, and that's a funny balance, I guess, the police and what we do here. There have been occasions where the police have turned up. They've heard someone comes here for treatment, or whatever, and they want to interview them or see them. And we have to have a balance of what does happen here and doesn't happen here. And I think what's fantastic is we have some great links with the police where we can go to them and say, I know, you're looking for so-and-so, and maybe, one of your PCs came and asked us a few questions, but it makes it really awkward for us, and it makes it awkward for the clients that are coming to treatment here. Because there's two teams here, really. We have the community team, which is all voluntary. Every client who comes here in my part of the community team are either referred from a GP or self-referred, or referred from those specialists, probation or whatever. Not always going to turn up. So the skills of my staff here have to be extremely high, because it isn't a case of they have to come, they volunteer to come. So how my guys work with the client, it's like going to a restaurant. The last meal you got, if it was a good one, you'll come back. So they can't afford to have an off day, my staff, really. They really have to be on the ball all the time. When you're hearing stuff that they hear every day and dealing with it, that's a lot, and I've got so much respect for the staff I have here. Whereas I've worked in the criminal justice field for years as well, where, dare I say, coercive treatment at times, where someone, for instance, on restrictions on bail or probation order, where they have to turn up for treatment. It also works very effectively. Don't send the wrong message there, because it does work really well. However, I think the skills of the workers are different, very different. So, as I was saying, we have the mobile as it goes out as well, and if we do decide someone's prescribing, then what we do, we will then set up a medical for them, and they will go to INDAS, part of Devon Drug Service, which is over at Wanford Hospital. And they're the specialist prescribers. What we do here is the psychosocial intervention. Call it what you wish, talking therapies, or whatever. A lot of the work we do is based on actually CBT-based workshops. Done a lot in my time. I've been working in this field for nearly 20 years, from 12-step to CBT to combination of both to everything. The system we've got here, I'll definitely say is the best one I've worked with. I don't know if that's because it's not criminal justice, I don't know. This is my first trip out of the criminal justice field. I've been here for about 2 years now. But it works really well. Sort of workshops we have. I've got to put them up all up here so I remember them when you came. If a client's first coming into treatment and we've got them they clearly want some effective treatment, then we run stage 1 sessions, which are, for instance, talent motivation stuff, looking at their social networks, and obviously relapse prevention work. And that's there are a few more things there: feelings, mind traps, thinking, roadblocks, staying motivated, towers of strength. But it's all that really is around motivation. It's about motivating someone and keeping them motivated and making them aware of where they may start to slip, or things that they can recognise. Then once we get someone really sort of quite engrossed into treatment, then we'll go into the stage 2 of our workshops. These are much more in depth, looking at confidence and assertiveness, rights and boundaries, a bit more about knowing yourself, about healthy relationships and their own health and physical health. So it's about social skills, really. One of the major things I've learned over the years is part of our clients, most of our clients, I've been in the drug field, in the drug scene roughly from maybe say 12, 14 up to mid-30s. That's a real me putting out and putting a label on something, I guess, but a lot of our clients are at that stage. And that's the stage where you and I, a lot of us learn our social skills. We learn boundaries, we learn what's accepted, what isn't accepted, we learn how to communicate effectively. And a lot of the clients which we work with have lost or haven't even gone through that stage, haven't sort of learned that properly. So a lot of our work is around that. Someone may come with a presenting drug issue, but they haven't got the skills to get off the drug. They know they want it's wrong, bad for them. They know it's, but they haven't got the skills. And a lot of the work we do actually is around that. It's about giving them the skills to do it themselves. So we was just there's plenty of places I've lived in London and worked in London where in the East End, people are just taken away with their families, locked away somewhere and done cold turkey. And yeah, okay, you get them clean, but you haven't dealt with anything at all. And the chances are they'll get a drug problem again within 3 months. But this is really good work. I really love this stuff. It's really effective. And then we also, obviously, as I said, we are around harm reduction. So we do a lot of work around harm reduction, a lot of workshops around awareness, heroin awareness, alcohol awareness, just what that drug is doing to you. Stuff like that. Harm reduction comes into that. Blood-borne viruses, massive, obviously. Because, a lot of clients think if as long as they're not sharing a needle, then they're not taking any risk of sharing the blood-borne viruses, but there are many other risks. You'll see them using separate needles but sharing the same spoon and stuff like that, and for heating the heroin. And the last one is bolt-ons, another set of workshops we do, which are stuff which maybe only be appropriate at certain times. So we'll get a group together and run this workshop. Looking at aggression, things like that. There's a women's group, there's a men's group, self-esteem, and depression as well. Look at that. My workers are not counsellors, however they are, some of them are trained counsellors, but whilst they're in this building they're not counsellors, however they do use counselling skills. We run this model on everyone uses this model. We all work to this model. And everyone in Devon Drug Service now, all the psychosocial interventions is run on this model. And it's all run the same way. And so, for instance, if someone was to move in around Devon with clients, they could pick up the same workshops before they're on Devon. And also that works in my benefit as a manager is if I was to get a member of staff from another part of Devon because I've got them, they can just step straight in. So that really helps me. I've waffled on for a bit, sorry. I can go on for ages and ages about this field, I love it. We all come into this field for different reasons. I have some people that are ex-service users. I have people that have never touched drugs in their life. I have people that have members of their family who have been involved in drug and alcohol issues. Lots of different reasons people come into it. But you have to be passionate about it, otherwise you get dragged down so quickly. And all my staff here are great.